She is at the grocery store at 32 weeks, standing in front of the bananas when it happens. A slow tightening across her entire belly. Not painful exactly, but unmistakable. The skin pulls taut. The muscle goes rigid. The whole front of her body becomes, for a strange and disorienting minute, hard as stone. She puts a hand on the side of her belly and freezes in the produce aisle. She thinks for one shocked second that this is it. Labor, now, by the bananas. She glances around, sure that someone is going to notice that her water is about to break across the floor of the supermarket. But she is only 32 weeks. She knows it cannot be. She breathes through it. She waits. And then, just as suddenly as it arrived, the wave passes. The muscle relaxes. The skin softens. The world resumes around her. The man choosing avocados a few feet away has noticed nothing. The cashier across the store is still scanning items. She stands there with her hand still on her stomach, heart still racing, and she wonders the question every woman in the third trimester eventually wonders. What was that? And if it was not labor, then what is her body doing to her right now, in the middle of an ordinary Tuesday afternoon, with no warning at all, in front of a wall of bananas? She does the thing every pregnant woman does. She opens her phone and types the question into the search bar. Why does my belly go rock hard during pregnancy? The answer she gets is always the same. A line on a hospital website, a note in a pregnancy app. Those are Braxton Hicks contractions. They are practice contractions. They are normal. Do not worry. The answer is correct, technically. The answer is also so vague and so dismissive that it teaches her absolutely nothing about the most powerful muscle in her body and what it is currently rehearsing for. It is the sort of answer that ends the conversation before it has started, and pregnant women have been receiving variations of it for generations now without ever being told what is really happening underneath. But here is what nobody tells her. The word practice does not begin to capture what is actually happening inside her body during those quiet, alarming moments. The uterus is not just twitching. The uterus is doing one of the most extraordinary acts of biological preparation any human organ ever performs. And once she understands what those tightenings actually are, the experience of feeling them shifts entirely from something a little frightening to something almost reverent. The phenomenon was first formally described in 1872 by John Braxton Hicks, an English obstetrician who noticed that women in the later stages of pregnancy experienced periodic, painless uterine contractions long before labor began. He documented them. He published a paper on them. He gave them his name. And then, for over a century afterward, the medical establishment essentially shrugged. Braxton Hicks contractions were considered a quirk, a muscular twitch, maybe the uterus practicing, maybe just random spasms. Either way, nobody knew exactly why they happened, nobody understood their structure, and nobody had the tools to look closely enough to find out. For most of the 20th century, women were told the same thing. They are still often told today. It is normal. Do not worry. And that was the end of the conversation. The dismissal made a kind of sense at the time because the tools to look any deeper simply did not exist. The uterus, when not in active labor, is a quiet organ from the outside. The activity inside it is electrical, microscopic, and invisible without the right kind of instrument. So, generations of doctors observed the contractions, named them, and moved on. The dismissal was passed down through the medical literature for over a century. Older obstetric textbooks devoted maybe a paragraph or two to Braxton Hicks contractions. Older nursing manuals treated them as a curiosity to mention to expectant mothers in case they panicked. Older midwifery guides framed them as a kind of body theater, a performance with no audience and no script, signifying nothing in particular. And in the absence of better information, generations of pregnant women have been arriving at their providers' offices in real fear during the third trimester, only to be told some version of, do not worry, this is normal, and sent home without ever learning that what they had felt was, in fact, one of the most remarkable acts of biological self-preparation in the human body. The story behind the dismissal is finally beginning to change, but it is changing slowly, and very few pregnant women have heard the updated version yet. The grocery store moment that frightened her was being filed in her own mental record in the same dismissive category her own mother probably used. Nothing to worry about. Normal. Move on. The truth is that what was happening to her in front of the bananas deserved more than a brush-off in a pregnancy app. The conversation has changed dramatically in the last 2 decades, thanks to a quiet revolution in uterine imaging. Research teams led by figures like Dr. Robert Garfield, then at the University of Texas Medical Branch, and Dr. Holger Mall in Germany, began using a technique called electrohysterography, which records the electrical activity of the uterus the same way an electrocardiogram records the heart. They placed sensors on the abdomens of pregnant women and recorded what was happening at the electrical level inside the uterine muscle. What they found was that the uterus, far from being a simple muscular bag, is actually a remarkably coordinated organ that generates organized electrical signaling throughout pregnancy. Braxton Hicks contractions are not random. They are the visible surface of an underlying electrical conversation that is gradually teaching the uterine muscle fibers how to fire together. In early pregnancy, these contractions are scattered, brief, electrically disorganized. As pregnancy advances, the contractions become longer, more coordinated, more synchronized across the entire surface of the uterus. By the third trimester, when she feels her belly go rock hard in the grocery store, the uterus is performing what is, essentially, a small dress rehearsal of the choreography it will need at labor. Not random, not accidental, organized. The uterus is the only organ in the human body that grows an entirely new organ inside it, the placenta, and then must perform the most powerful muscular contractions a body is capable of and do it perfectly the first time with no second chance, with another human life depending on the outcome. Braxton Hicks is how it gets ready. And the reframe goes deeper than mechanics. The uterus is, by some measures, the most powerful muscle in the human body during labor. Pound for pound, the contractile force a uterus can generate exceeds that of any other muscle in human anatomy. But all of that power has to be developed, calibrated, and tested. The muscle fibers have to learn to fire in coordinated waves rather than scattered twitches. The blood vessels feeding the muscle have to expand and adapt to the immense metabolic demand of sustained contraction. The cervix at the bottom of the uterus has to gradually soften from something almost cartilage firm to something that can stretch open 10 centimeters wide. None of this can happen overnight. None of it can be triggered by a single hormonal signal at the moment labor begins. All of it has to be rehearsed over weeks and months. And every Braxton Hicks contraction she feels is one rehearsal in a long, slow training program her body has been running, completely without her conscious involvement, for months. The program is brilliant. By the time real labor begins, the uterus will have practiced thousands of contractions of varying intensity. The muscle will know its choreography. The cervix will have begun to soften. The blood supply will be ready. Her body will be prepared in ways that no amount of conscious effort or birthing class could ever provide. The class teaches her what to expect. The training her body has done for months teaches her body what to do. And here is the part nobody mentions, the part that, once you know it, makes Braxton Hicks contractions feel almost like a gift instead of a fright. Each time the uterus tightens, it temporarily compresses the blood vessels in its own walls. When the contraction releases, blood rushes back through those vessels and floods the placenta with a fresh surge of oxygen-rich, nutrient-rich blood. In other words, every Braxton Hicks contraction is not just rehearsal for labor. It is also, in a small and continuous way, a delivery of extra circulation to her baby. The same contractions that feel alarming to her from the outside are, on the inside, briefly improving the quality of her baby's environment. The uterus is training itself and feeding the baby better while it does. Two purposes in one motion. There are few things in human biology this elegant, and almost no one ever tells a pregnant woman that this is what her body is doing for her child in those alarming minutes by the bananas. And the rehearsal goes beyond the muscle. Through the third trimester, the cervix at the bottom of the uterus is undergoing one of the most dramatic structural transformations in human anatomy. For most of pregnancy, the cervix is a dense, fibrous plug, almost cartilage firm, designed to keep the pregnancy securely inside the body. It has to be strong. A weak cervix can lead to miscarriage or preterm birth. But for labor to happen, that same dense plug must transform into something soft, pliable, and capable of stretching open 10 centimeters wide in a matter of hours. The change is enormous. The mechanism is gradual. Over weeks, biochemical signals begin to remodel the collagen fibers that make up the cervix. Water content increases. Enzymes break down the rigid scaffolding. Inflammation, the same kind that helps a wound heal, begins to soften the tissue. By the time labor begins, the cervix is in a state of readiness that has been built across the entire third trimester. Braxton Hicks contractions play a quiet role in this process. Each contraction places gentle, intermittent pressure on the cervix, contributing to its gradual softening. Her body is not just rehearsing the contractions. Her body is preparing the entire architecture of birth in parallel on a schedule that has been refined over millions of years of evolution. The grocery store moment that frightened her is one small visible note in an entire symphony her body is rehearsing in silence. By the time the curtain rises on Labor Day, every section of the orchestra will know its part. This is also the place where the medical caveat matters most because not every tightening is Braxton Hicks, and the difference matters. Braxton Hicks contractions are irregular. They do not come in a predictable pattern. They do not steadily increase in intensity over the course of an hour. They are usually uncomfortable rather than truly painful. They tend to fade with a change of position, with a glass of water, with rest, with sitting down somewhere quiet. Real labor contractions are different. They come at regular intervals that get closer together. They get stronger over time, not weaker. They do not stop when she lies down or drinks water. They feel less like a tightening and more like a deepening, painful wave that radiates from her lower back around to her front. And in the third trimester, especially before 37 weeks, any pattern of regular, intensifying contractions deserves a call to her provider, not a wait and see. Preterm labor is rare, but it is one of the few things during pregnancy where calling sooner is always better than calling later. If her water breaks, if she has bleeding, if the contractions become regular and painful before full term, she should call. Her provider would rather assess and reassure her than miss something that needed attention. Trust the rhythm her body has settled into. Trust the pattern of those occasional irregular tightenings she has come to know. And when the rhythm or the pattern suddenly changes, trust the instinct that says, something is different. That instinct is real, and it deserves a phone call. So the next time she is somewhere ordinary, the grocery store, the office, the couch, and her belly suddenly goes hard as stone for a minute, she should know exactly what is happening. Her uterus is not panicking. Her uterus is not malfunctioning. Her uterus is rehearsing the most important muscular performance her body will ever produce and feeding her baby a little extra while it does. The tightness she feels is the visible echo of an invisible curriculum her body has been running for months, without lectures, without warnings, without her conscious participation, and entirely on schedule. She has not been doing nothing. Her body has been training for the most demanding day of her life, and she is, in some small way, watching it train, with her hand on her belly, in the produce aisle, on a Tuesday afternoon when she just wanted to pick up some bananas. The body is wiser than the conversation around it. The body knows what is coming. The body has been getting ready for months, in plain sight, every time she felt that strange stone-hard wave roll across her belly and then disappear. If this video gave you a new way to feel those quiet tightenings, take a moment to like and subscribe because we go deep on the science that makes pregnancy real. Leave a comment telling us when you first felt your belly go rock hard and where you were when it happened. Tell us if you thought it was labor. Tell us if you froze in a public place, hand on your belly, sure that the whole store was about to watch your water break. Tell us what you did next. We read every one of these comments because almost every woman has a version of this story, and almost every woman remembers it years later. And almost every woman has gone through it alone in some ordinary aisle on some ordinary day without ever knowing what her body was actually doing for her child in that moment. Take care of yourself this week. We will see you in the next one.